Hello viewers, I am Dr. Shaileshkumar Garge, Citi Vascular Hospital. Varicocele is a very common problem affecting most of the young patients, male, and it has made the life of these varicocele patients miserable because a lot of patients are suffering with the varicocele. They may be in the grade 1, grade 2, grade 3, grade 4, grade 5 radiologically, but most of them are in the grade 1 and grade 2. Still, some patients, though they are in the grade 1 and grade 2, they have pain. Some of the students, those who are trying for the police, army, they are suffering with the grade 1 and grade 2. Even though they don't have pain, they are scared of whether they will get selected to the army or police or not, or their life will be screwed with this varicocele. So it has affected a lot of young males. So we'll see how these early grades like grade 1 and grade 2 can be treated or can be reversed naturally. Also, those patients who are not suffering with the varicocele, but if they follow these methods, then they can prevent the varicocele from developing. So what are these? One, previously we have seen the posture, previously we have seen the temperature management. Now we'll see few other things which we can, by our techniques, we can reverse the varicocele naturally. So first is the change in lifestyle. So what it is, if you are smoking, then you should stop smoking. Why? Because smoking will make your blood thick, it will affect your sperms, it will affect the testis, and your testosterone levels, that is male sex hormone, will reduce. So when the blood becomes thick, it will become very difficult for the heart to pump the blood against this thick blood. So if you are suffering with if you are doing smoking, it's better to stop right now. So other thing is alcohol. So alcohol is the same. Again, it will affect your liver. We all know that it will make the blood thick. Then it will affect the testosterone levels. It will affect the sperm production, and more important, it will cause erectile dysfunction in the male. So a lot of young patients, those who are suffering with those who are drinking regularly, they might experience this erectile dysfunction sooner or later. So that's the reason you should stop alcohol drinking on regular basis. So third thing is coffee. So drinking coffee, especially towards the evening time, we all know that coffee we drink to keep ourselves alert, to keep ourselves focused. So if you drink the coffee in the evening time, it will stop your sleep, it will cause insomnia, means that is sleep disturbance, and we all know that our body heals when we take rest, when we sleep. So that's the reason it is very important to avoid coffee during the evening times, because if you have coffee, then your sleep will be disturbed, and the varicocele which is there, the healing or repair which will occur when we take a sleep or rest, that will be disturbed. So the fourth thing is porn masturbation. So there is way to do the masturbation, and if the masturbation is not healthy, if you are doing a unhealthy practice of masturbation, porn masturbation, then it will increase your varicocele symptoms, it will make your varicocele worsen. So what is the unhealthy way of doing the porn masturbation? That is watching the porn on laptop, sitting and doing the masturbation, doing it very aggressively, squeezing the veins around the testes, squeezing the penis aggressively. These are the unhealthy ways of doing the masturbation. And before and after the masturbation, you should avoid exercise, you should avoid hot bath, you should avoid traveling. So these are the unhealthy techniques. In my next video, because there is this porn masturbation is very unhealthy technique, and I will talk some other time in detail only on the porn masturbation. So these are the lifestyle changes. Apart from these bowel habits like constipation and gas formation, if you are suffering with that, then better you avoid the constipation, you avoid the gas formation or bloating, because constipation when constipation is there, you try to put pressure to pass the stools, and that pressure, abdominal pressure which is raised, it will be reflected in your scrotum, and the veins in the scrotum will enlarge. So the patients who are suffering with the varicocele, they will have varicocele symptoms worsening, and those patients who are not having varicocele, they will develop varicocele if you have constipation. So to prevent constipation, we all know that you should have adequate hydration, you should have a high fiber diet, try to avoid hot, non-veg, spicy food. These are the few things. So another third thing which you should avoid is if you are having a chronic cough. Chronic cough patients, those who are TB patients or those who have some lung problems or asthma, they cough regularly, they cough repeatedly. So that coughing will increase your abdominal pressure, and as abdominal pressure increases, as I said, even in the constipation, when your abdominal pressure is increased, that pressure will be reflected into the scrotum. So that pressure we should stop. So show to your physician, control your cough and prevent the varicocele from worsening or developing. The third thing is Indian way of doing toilets, using the Indian style of toilets, because that is a natural. We all know that now when we are using the Western toilets, the more of piles, the more of constipations, and Indian way of style, it will reduce the pressure on the veins in the pelvic region. So that is fourth thing. So fifth thing is controlling the weight. So weight reduction, obesity, when you have a tummy, huge tummy, or when you are obese, the fat will put pressure on the veins in the pelvis, and these veins will have to pump the blood against those pressure, and these veins in the scrotum, they swell up. So reduce weight, reduce tummy fat, and you will prevent the varicocele from developing, or the varicocele symptoms will reduce if you are already suffering. So these are the 5-way change in the lifestyle techniques which will help in naturally reversing the varicocele, or it will prevent the varicocele from developing. If you have any doubts or comments, please put them in the comment box. I'll personally read each and every comment and will try to answer them. You can watch our previous video, the change in the posture and the temperature management of the varicocele, to prevent that. Thank you.